Welcome back to the Reflection Room. Hannah and myself, we are so excited about our topic today and the guest that we have to share and talk about his expertise in this area with you all. Depression and TMS therapy is a topic that has come up multiple times in sessions on social media. We see that there are a lot of posts lately on that, and it's been a trending topic. And so we thought, why not invite someone who knows what he's talking about in this area? So let me welcome Dr. Griffith. He is a board certified psychiatrist, and he completed his medical degree at the Ohio State College of Medicine and then his psychiatry residency at the Cleveland Clinic. He has since opened his private practice where they offer medication management, medical weight loss, and TMS therapy. Welcome, Dr. Griffith. How are you?
I'm doing well today. Thank you for involving me in your podcast. And it's a pleasure to really meet the two of you in this type of setting and to talk about some exciting things in psychiatry. It's also great to create a networking relationship with your group of therapists at the Tampa Counseling Place. And I like the word place because in my mind, it makes me think that I arrive at a destination that has answers. So it's a very creative, inviting name. So
I love that. Thank you for picking up on that. There was some intent behind that word. We thought that place seemed just more of a welcoming, comforting space, and so I'm so glad you picked up on that. Yeah, thank you for attending. So tell us a little bit about yourself. We'll start there before we get started in talking about TMS therapy.
Born and raised in Ohio, Northeast Ohio, which has the cloudy lake effect of the weather systems going across the Great Lakes, and it's perpetually cloudy. And cloud cover is number 2 to Seattle, Washington. So it ended up in Florida. I needed some sunshine for my own wellness. And I've been here for 30 years with my wife. I said, we need to move to Florida. She said, buy me a home on the water. I said, okay.
Done.
Kids here. We're empty nesters. We have 3 little yapper dogs. I enjoy being in private practice psychiatry in St. Petersburg, which is where I started and will end, hopefully. I love psychiatry. I love meeting people. I find people fascinating. And it's fun being in the role of a psychiatrist to help them find happiness and wellness and to deal with stress. So I do a lot of that with medication management over the years. But in the past 6 years, our practice began providing transcranial magnetic stimulation, which is TMS, and it is so effective. And there's such a high need for it that we expanded from our St. Petersburg office to an office at Lakewood Ranch near Sarasota, and also an office in North Clearwater, the countryside area. So we're really gratified as a practice to provide so much help to so many patients through TMS. And we also do medication management. We have 6 providers in total, myself, 4 physician assistants, and 1 nurse practitioner.
Oh, that's awesome. Would you mind giving us an overview of TMS and what it is?
Yes. So in the brain, there are 300 to 500 billion brain cells. And during clinical depression, they're sleeping on the job. The brain is actually utilizing a reduced amount of oxygen, glucose, and there's even reduction of blood flow in the brain. So in concert with you guys, which tried to turn the system back on through counseling, which is kind of a software solution if you think about it. In psychiatry, we try to handle the hardware solution, which is reversing those biological deficiencies. And of the 500 billion brain cells, most of them I call blue-collar workers. They provide metabolic and structural support to the rest of the brain. The white-collar workers are the smart brain cells. They're called neurons. The mood circuitry is composed of about 25 million neurons, and there's 3 types: serotonin, norepinephrine, and dopamine. And they go through the entire brain. And when that mood circuit gets depressed, it makes the entire brain depressed. So from a biological standpoint, when medications so often don't work, because they're limited to one type of mood circuit neuron. There's serotonin, norepinephrine, and dopamine. I call them the 3 flavors of ice cream. Almost every antidepressant a person tries will bring enhancement to one flavor of ice cream only. So for instance, a person taking Prozac, it'll help the serotonin part of their depression, but not norepinephrine and dopamine parts of their depression. So people so often get partial responses to antidepressants. In addition, prescribing medication is like pouring creamer into black coffee and mixing it up. The medication goes everywhere in the body, and any organ system in the body can develop side effects to antidepressant medication. I spend half my time trying to find the right flavor of ice cream for the patient, and then the other half I have to deal with all the side effects that occur. And it's a long list of side effects from antidepressant medication. TMS, transcranial magnetic stimulation, is completely different because instead of a chemical solution of creamer and black coffee and being limited to only one flavor of ice cream, we can target a very small area on the surface of the brain, right about where my finger's pointing. It's a small area, about maybe surface area of a quarter and about half an inch depth from the top surface into the brain. All three flavors of ice cream pass through this special area because it contributes and helps control executive function of the entire brain and the entire person. And all three flavors of ice cream at some point in their journey through the brain pass through this sweet spot, I call it, where you can access that with magnetic pulses. And that's what transcranial magnetic stimulation does. Now, magnetic pulses are the same magnetic pulses that are used in MRIs. And if either of you two have ever had an MRI, those magnetic pulses are the clicks you hear when you're in the claustrophobic tube of an MRI machine. The magnetic pulses are completely harmless to human tissue. But in TMS, you're not in a claustrophobic tube. You're sitting comfortably in a recliner. Your head rests on a headrest, and a support arm holds a magnetic coil right at that sweet spot. And we can treat that sweet spot almost exclusively, sparing the rest of the human body, the rest of the brain, and on-off magnetic fields will restart the electrical function of the mood circuit neurons. So neurons work electrically and chemically. And it's almost like the batteries are dead in the three flavors of ice cream. And TMS, it on and off magnetic fields restart the electrical current safely. So it's essentially putting jumper cables on the serotonin system, jumper cables on the norepinephrine system, jumper cables on the dopamine system, restarting the dead batteries. Because there's 500 billion brain cells, it takes a while to wake them up. But that's why we have 36 treatment sessions, each one lasting 18 minutes, providing 3,000 magnetic pulses. By the end of week 2, most patients are starting to feel improvements. And then the improvements just gain momentum so that by the end of it, more than 80% of patients are feeling better than they ever felt on any medication. And the effects of the improvement of TMS is durable, meaning most of our patients kind of live happily ever after. Many of them can reduce their antidepressant medication, even stop them. And not very often do they need to come back for another treatment. That is an exciting way to treat patients with depression, and that is TMS.
Wow.
I love that. I mean, I have so many questions after that description. That was really great, Dr. Griffith. And I love the examples that you use in terms of ice cream flavors or sleeping cells needing to wake up those cells, or even the blue collar, white collar workers. There's something about, I do some narrative therapy, and there's something about like storytelling and metaphors, and even the importance of choosing certain words to describe something that I feel like helps people gain a better understanding of what exactly it is that we're discussing. So I love how you broke that down. Thank you so much for that. And I can tell you're very passionate about this topic, which also helps as well. So I wanted to back up a little bit, if it's okay. You mentioned about 6 years ago is when you decided to introduce TMS therapy into your practice. I may have gotten that number wrong. I don't know, but that's what I think I heard, right? What was happening around 6 years ago that led you to realize I probably should incorporate this into our practice as a psychiatrist and specialize in this area? Is there anything that we need to know as those working in the mental health field, or even those that are identified as clients or patients, that would be interested in knowing what was happening around that time, about 6-7 years ago?
Yeah, I mean, in 30 years, I've been a psychopharmacologist, and I pride myself on paying attention to the needs of the patients, trying to understand which flavor of ice cream needs the most help. Then you have to understand which medications are best for certain flavors of ice cream and why. But the worst thing is all the side effects of medication. You can make someone take them clear out, give them remission from their depression, but they're sleeping all the time, or they're perpetually nauseated, or, they're just feeling no feelings, like their depression's gone, but all kinds of side effects. And TMS, at the time that we considered TMS in our practice, there was also ketamine. So ketamine is a medication. It's been around for decades. You can buy it for pennies. It's generic, and it provides twilight sedation, like in dental offices, oral surgeons, some outpatient procedures. So it's a lightly sedating medication in the dose that they can use it. And I was sending patients for ketamine treatment when their major depression was not responding to medication to a colleague over in Tampa. And what I found was 1 out of 3 patients would have some benefit from ketamine. But unfortunately, the benefit would last maybe a week or two. So they kept having to go back and get more ketamine shots or IV infusions. And the problem with ketamine is that it's a procedure that a person gets it in the office, then they have to be monitored for 2 hours afterwards. Their cardiac status, like their blood pressure, you have to make sure that it's a hallucinogen, ketamine. When you use it clinically, you want to give enough of it so that they have this twilight sedation. They're, kind of foggy and tired, but you don't want to make them act like they've had LSD and they're hallucinating. So there's a fine line there. And then they have to be monitored in the office for 2 hours. They can't drive for the next 24 hours. And they kept having to go back. So it was very cumbersome. And I was disappointed with the results. It just didn't work often enough. So we looked at TMS. TMS is completely different because it's not a chemical that goes everywhere in your body causing side effects. It's a harmless magnetic pulse, no harm to human tissues whatsoever. I've treated successfully 5 women in the second trimester of pregnancy. They all had full remissions after failing medication. And they didn't want to take medication because they're pregnant. They wanted to protect their baby. One of the 5 women is a practicing OBGYN. And that's a strong testimony as to the safety of TMS. So a TMS treatment session is completely different than ketamine. So ketamine and TMS are like on the forefront of psychiatry right now to help pick up the burden when medications don't work for depression. And I feel that TMS is far superior. A TMS treatment session, a person drives to our office. They don't need a companion. They sit in a recliner. They can watch TV. They can talk to the technician during the treatment. The treatment lasts 18 minutes. After the treatment, they can drive to work. They can drive to the mall, drive to the gym, drive home. And they do that on a daily basis. So it's Monday through Friday. And it's 36 treatments. So it's a 7-week commitment. But who can make 36 straight weekdays? If they miss a day or two, we add them on at the end. If they miss a week because they're going on a cruise, we add a week on at the end. So it has great flexibility. But rather than only 1 out of 3 patients showing improvement, with TMS, we have more than 80% positive outcomes. Most are remissions, completely better. And a significant amount, they're considered responders, which means at least 50% improvement, but they're strong responders, almost reach remission. And so hands down, if you're going to go to Vegas and bet on ketamine versus TMS, you're going to make a lot more money with TMS. Now, TMS is a big investment. To get a TMS chair, it's an investment of 6 figures. So, and then you have to train the staff, the technician, and then you have to fight with the insurance companies because they don't
I'm
have.
sure.
But we're really good at doing what we do. Right, free consults of anybody who's interested in TMS. We do a great job of gathering all the clinical data. So we hardly ever get turned down by the insurance companies because we're very appropriate in what we do. We know what we're doing. And if a person has to try one more medication to get approval by insurance, we'll help them do that. So to answer your question, that's what was going on 6 years ago. I think TMS was the best choice we could have made. It was so effective. That's why we expanded to Lakewood Ranch and Countryside. And it's interesting because at the time, 6 years ago, my practice had done well. I could retire. And I was thinking of retiring. But once we got into ketamine, it's like, oh my God, this is so much fun to help these patients get so much better. So it was like a chapter 2 for me. And it was so exciting that my daughter had finished PA school. So she's a physician assistant. She joined our practice. So she was invited. And then my son, who was a municipal bond trader, he was bored looking at 3 computer screens every day. He said, "Dad, can I come and work for you?" So he's our director of operations and business development. And then my daughter, who's married in Houston with 2 little kids, she was working in the financial industry and she had a great job. She was making 6 figures. She said, "Hey, Dad, can I come and work for you?" So she works remotely for us. And I now have a Texas medical license. She lives in Houston. I think we may even expand to the state of Texas. So there's a lot of excitement. And I think I answered your question and then some.
Yeah, I love that. And I actually had a question about like during pregnancy, because I think that's fascinating. Do you think that this could be like a new treatment in postpartum?
Absolutely. And postpartum depression is, gosh, it's a tough entity to treat. It's often accompanied by psychosis, but there's a lot of data out there where research studies where pregnant women have been treated and also postpartum with in both settings. TMS is very safe and very effective. In postpartum depression, however, you're fighting a hormonal storm. You're also fighting an acute, significant environmental change. Often with postpartum pregnancy, there's an element of psychosis, like paranoia, things like that. So you often have to combine the use of medication with TMS. Let me just real quickly mention what the side effects are to TMS. It's time out of your schedule and gasoline in your car. But then after that, the side effects tend to occur only in the first week of treatment through the 7-week course of treatment. It's mild tension headache after a treatment session that lasts about 2 hours that can be easily managed with therapeutic doses of Tylenol and or Advil. And secondly, some people also in the first week of treatment of TMS, later in the day after a TMS session, they feel tired. They may want to take a nap. That's not to say that TMS is sedating, like, "Oh, I just had my treatment, I can't drive home." No, they're fine. But it's like later in the day, they may feel a little bit tired. So it's not dangerous. It's not a coma or anything like that. It's just they take a nap. And both those side effects clear up in the first week, typically. So then the rest of the 6 weeks, there's essentially no side effects. So
I love that you were talking just now about the side effects. One of the things, and Hannah can probably attest to this too, and so can you, Dr. Griffith, but whenever we're working with clients that maybe we've been trying therapy for a period of time and we just haven't, for whatever reason, noticed any changes in their PHQ-9 or something, let's say, that we've administered. So they're still really kind of experiencing the symptoms pretty severely. We might recommend medication then. And so we always get this question, or there's this hesitation like, "Oh, I don't want to have to deal with the side effects," right? So that's one thing that we oftentimes have to talk about. And then I also noticed too, whenever our clients fill out, we have a pretty extensive intake form. And when they fill out that intake form, on there's oftentimes, there's a place for them to list their medication. So oftentimes they do. And then also a number of side of just emotional and physical health symptoms that they're experiencing. And sometimes there is some overlap there where I might say, you might want to talk to the provider who's administering the medication and see if any of these symptoms that you're experiencing are directly related to the medications that you're taking. So side effects is a big thing when it comes to medication management. And so I was going to ask, are there any other major concerns that we could probably answer like ahead of time today for someone who's considering TMS, but they might just be a little bit concerned or a little bit hesitant? Are there some things that come up in your office that patients often ask about?
right. So let me answer that. It's kind of not related specifically to your question, but I've been doing psychiatry for 30 years and I'm a big believer in psychotherapy. And I think probably almost every marriage should probably have 3 legitimate counseling sessions. You get married, but after a year, here's your counseling sessions. It really, so I'm almost always providing some form of counseling when I have appointments with patients. And it's very brief. And it's hard to refer patients to psychotherapy or counseling because, the patient has a personality. And then the therapist, they have a certain skill set, a certain approach. And you have to get a chemical match, like good chemistry between the patient, their needs, and the skill set of the therapist. So I'm real picky in making referrals. And I think one good thing is that your practice has so many diverse clinicians and they're young and enthusiastic, but yet they're experienced. So, it's nice that there's a lot of different choices um, for that. So when patients, technically in insurance companies, patients will be authorized, generally speaking, if they've failed 2 antidepressants historically. And it needs to be like not 20 years ago, but more in the last few years. And they have to be 2 antidepressants in different families. So maybe a serotonin medication and something that's not a serotonin medication. So when people meet those criteria, they can be approved for TMS. But then they often, they obviously have questions like, oh, are there any problems with it, with TMS? And really, it's that first week, the mild tension headache and the little bit of tiredness. But the research data on TMS, which is actually FDA approved since 2008, 17 years ago, is very clean in terms of side effects. The risk of having, here we are providing magnetic pulses, which then creates electrical stimulation in a very small part of the brain. It doesn't cause seizures any more than Prozac, 20 milligrams a day. So it's very safe in terms of seizures. And some people say, well, I have migraines. Is it going to trigger migraines? Actually, TMS can treat migraines. We've had several patients who get treatment for depression from TMS from us, and they've been able to go off all their migraine medications, including the biologics, the more recent ones. So, I think the danger is like when you go online and you start looking at some of the anecdotals on, oh, I got TMS and it destroyed my life. I mean, I've been doing it for 6 years. And I think what happens is that some patients, they, rather than being psychologically insightful about what they're feeling and thinking, they develop like physical symptoms instead. Breathing problems, anxiety, GI problems, whatever. And I think that's the type of person who will kind of scapegoat TMS as causing side effects because they don't have the insight. Now, they never have, unless I see folks like you for a long time, they're never going to get it. Or someone maybe with a personality disorder and basically personality disorders, you could think that the world is always a problem and they never can attribute accountability to themselves. And so that TMS doesn't make them get better from that. So sometimes personality disorders won't get better. The only other risk I see with TMS is when someone actually has manic depression or bipolar disorder, which is not evident historically or currently to my evaluation. And TMS is so effective at treating depression, low energy, low motivation. It lifts them up, and then it lifts them up too much, and they start getting a little manicky. And I've seen that happen in 6 years about 2 or 3 times. But we stop the TMS, and they do okay. Or we lower the intensity of the magnetic pulses, so it doesn't quite provide that much energy to them. I don't know if that answers your question, but that's my experience. I want to say one more thing. How does TMS play into someone receiving counseling? They're already in counseling or they want to pursue counseling. It's a positive, complementary, synergistic relationship between TMS and counseling. The reason I say that is that if someone's super depressed, they're not at the top of their game. They don't have much psychological insight. They're so pessimistic. They're so defeated. So it's nice when they get over some of those severe depressive symptoms where you can work with them as a therapist, get them to look at the positive side of things. And what I've seen with TMS is it helps get patients out of the victim role that they're in. It helps strengthen their ego, the positive ego strength that they need to stand firm and feel grounded. It helps them be more assertive. It helps them not be overwhelmed by stress. And so it always plays positively into counseling. All the psychotherapists should, if they're like finding that the improvement of their patient is very slow and the patient's still stuck in depression, definitely refer for TMS. I mean, I think TMS should be first-line treatment for depression because it's so effective, so safe, so tolerable, but the insurance companies don't want to part with their money.
Yeah.
Long-winded answer.
I'm glad that you cleared that up about like trying 2 medications, separate,
Right.
norepinephrine or serotonin or whatever it might be before they approve it. Because I think that would be a very common question if I were referring somebody. Because that's a big question for people is, can I get insurance to cover it? So yeah, that's great. Do you also think that it could, like, have you seen it with other disorders? So depression, you mentioned a little bit, bipolar, postpartum. Do you see it working with things like anxiety?
Yes, yes, it does. When you treat, this is like it's a major networking station in the brain. So the frontal lobes do executive function, our thinking, our decision making. And then that function of the brain passes through this like kind of network switching station. It's almost like an electrical panel that it has circuits that go out to your house and every part of your house. Well, that's what happens here at the dorsolateral prefrontal cortex where we treat depression with TMS. So it helps treating this area, helps with anxiety naturally. It helps with panic attacks, generalized anxiety, which is excessive chronic worry. And we can also, this is a fast frequency magnetic pulses. It's like 10 hertz, which is 10 pulses per second. If you think of depression as being tiredness, the brain sleeping on the job, think of anxiety as being too much activity. It's like, oh God, am I going to crash? And so it's like overactivity. So what we could do is on the mirror image on the right side, we can do slow pulses with TMS to slow down the overactive active anxiety neurons. So what we do is the insurance will pay for the depression treatment, which is 18 minutes here. And then we'll add 6 minutes of free pro bono slow frequency anxiety treatment for people. They'll say, gosh, my depression's getting a lot better, but I still have anxiety. Okay, well, let's start adding this anxiety treatment. And also to answer your question, TMS is also approved to treat obsessive compulsive disorders, and it controls their life, which is very hard to treat with medication. So TMS, we can use it with a different type of magnetic coil. And right at the vertex, which is kind of the top center of the skull, there's a part of the brain that we can access with TMS, and it really helps OCD. So there's been legitimate research showing that OCD treatment with TMS separates from placebo treatment, and it's approved by the FDA to treat OCD. The problem is it's a recent approval with the FDA, so the only insurances that pay for it are Medicare and Cigna. So it takes a while for insurance companies to embrace new treatments. So right now it's limited. I mean, someone can self-pay for it, and a lot of patients do, but it's nice to be able to get your insurance to cover it. Let me just tell you some futuristic TMS applications. I'm getting ready to introduce into my practice the use of EEGs, electroencephalograms, that measure brainwaves. And there's been research that clearly shows that you can treat autism with TMS. You use it, the patient has to have an EEG. It has to be analyzed by software that does, it provides a clinical analysis of their brainwaves in different parts of the brain. And there's about 5 areas of the brain that you can treat with low intensity magnetic pulses, not as strong as we use for depression. And there's phenomenal improvement in autism. And it's called personalized TMS because you first do a personalized EEG of the person, it becomes analyzed, and then the software creates a specific prescription of TMS, places and strengths for that person. Then, so TMS, we're just scratching the surface.
And there's also there's a lot of controversy surrounding ABA therapy as well. So that's always been the form of treatment that people have naturally recommended for parents that have children with autism. But there's a lot of controversy surrounding that kind of treatment too. And so for them to have another option, I think it's wonderful to hear. Yeah, that's really great. And I'm so glad, Hannah, you asked that question because I feel like a lot of times when people think of TMS therapy, they just initially think of depression, treating clinical depression. So I'm so glad, Dr. Griffith, that you were able to kind of share about some of the recent developments when it comes to TMS therapy. And thank you so much, too, for also highlighting the importance of counseling. I think the way you described it was perfect. Actually, when you were describing counseling and sometimes the need for there to be additional forms of treatment to help the client gain a better sense of clarity in order to really kind of work with a therapist, it made me think, I know you love your stories. So and metaphors, it made me think of your journey from Ohio to Florida and how Ohio was very cloudy.
Yeah.
And then you ended up coming to Florida because you and your wife, mainly you, were looking for more clarity and just to be able to live in the sunshine. But I think that's a good example of like what some of these treatments, medication, but then also TMS therapy. I think that's a good example for what it can provide someone who maybe has been working with a therapist for some time, or maybe a therapist who's been working with clients, and you just feel like you're in this rut, like you're just kind of stuck, or maybe you've plateaued and you're just trying to figure out like, what is it that we're missing? And so sometimes incorporating some of these other forms of treatments can be very beneficial.
Yeah, let me add something. TMS also is being shown to be effective for substance abuse. Yeah. Now, I'm not real privy to all the research on it, but there's a lot of kind of groundswell enthusiasm about that. But even more exciting for me personally, it's being looked at for post-traumatic stress disorder. And maybe not everybody has PTSD clinically, but we all live in trauma on a daily basis. Okay. So if TMS can help with trauma, that's really exciting. I know that I talked to a colleague who does TMS, and he's being funded by the DoD to do research studies on the military who have PTSD. And he says it's the results are very positive. It really is fascinating how it's an elegant approach to use magnetic fields to create electrical stimulation and reset the firing frequency of neurons in the brain. And the brain is so complicated, I think we're just getting started with it.
Yeah, I know this was so helpful. I feel like we could go on and really talk about this topic for another hour or two, but this has been helpful for me. I'm sure you feel that way, Hannah, as well. And we're definitely going to share this information with our clients and our providers at our practice. Dr. Griffith, if anybody wanted to reach out and get in contact with your practice, maybe come for a treatment, or if they have any additional questions, where can they find you?
Well, they can Google me. Walter Griffith, MD. They could Google the name of our practice, which is Dr. TMS Therapy. And I mean, there's other clinics that provide TMS, other psychiatrists, but it's such a safe, effective treatment. I just hope that if there are any individuals out there seeing you guys in psychotherapy or listening to the podcast, look into TMS. And you can call our office. We can do free consults. And if we can't treat you because you're too far away from us, we can refer you to someone.
Love that. Awesome. Yes. Well, thank you so much for your time. I really appreciate it. We're so grateful for you taking this time to chat with our audience. And hopefully you guys enjoyed this episode. If you have any questions, as always, feel free to write them in the comment section. And as we always wrap up our podcast, keep reflecting.